wonderforce.com.
Coronavirus disease 2019 (COVID-19) is an infectious disease caused by severe acute respiratory syndrome coronavirus 2 SARS-CoV-2-8. The disease was first identified in 2019 in Wuhan, the capital of Hubei, China, and has since spread globally, resulting in the 2019-20 coronavirus pandemic. 9-10 Common symptoms include fever, cough, and shortness of breath. Muscle pain, sputum production, diarrhea, and sore throat are less common. 5, 11, 12, 13 While the majority of cases result in mild symptoms. 14 Some progress to pneumonia and multi-organ failure. 9, 15 As of the 23rd of March 2020, the rate of deaths per number of diagnosed cases is 4.4%. However, it ranges from 0.2% to 15%. According to age group and other health problems, the virus is typically spread from one person to another via respiratory droplets produced during coughing. 17, 18 It may also be spread from touching contaminated surfaces and then touching one's face. 17 The virus can live on surfaces up to 72 hours. 19 Time from exposure to onset of symptoms is generally between 2 and 14 days, with an average of 5 days. 20, 21 The standard method of diagnosis is by reverse transcription polymerase chain reaction (RRT-PCR) from a nasopharyngeal swab. The infection can also be diagnosed from a combination of symptoms, risk factors and a chest CT scan showing features of pneumonia. 22, 23 Recommended measures to prevent infection include frequent hand washing, social distancing, maintaining physical distance from others, and keeping hands away from the face. 24 The use of masks is recommended for those who suspect they have the virus and their caregivers, but not for the general public, although simple cloth masks may be used by those who desire them. 25, 26 There is no vaccine or specific antiviral treatment for COVID-19. Management involves treatment of symptoms, supportive care, isolation, and experimental measures. 27 The World Health Organization (WHO) declared the 2019-20 coronavirus outbreak a public health emergency of international concern (PHEIC) on the 30th of January 2020, 28, 29, and a pandemic on the 11th of March 2020. 10 Evidence of local transmission of the disease has been found in many countries across all 6 WHO regions. Although those infected with the virus may be asymptomatic, many develop flu-like symptoms, including fever, cough, and shortness of breath. 534-35 Emergency symptoms include difficulty breathing, persistent chest pain or pressure, confusion, difficulty waking, and bluish face or lips. Immediate medical attention is advised if these symptoms are present. 36 Less commonly, upper respiratory symptoms, such as sneezing, runny nose, or sore throat may be seen. Symptoms such as nausea, vomiting, and diarrhea have been observed in varying percentages among people in several studies, with percentages varying from 3% to 31% of cases depending on the study. 37, 38, 33 Some initial cases in China presented only chest tightness and palpitations. 39 In some, the disease may progress to pneumonia, multi-organ failure, and death. 9, 15 As is common with infections, there is a delay from when a person is infected with the virus to when they develop symptoms, known as the incubation period. The incubation period for COVID-19 is typically 5 to 6 days but may range from 2 to 14 days. 40-41 97.5% of people who develop symptoms will do so within 11.5 days of infection. The disease is caused by the virus severe acute respiratory syndrome coronavirus 2 SARS-CoV-2, previously referred to as the 2019 novel coronavirus 2019 nCoV. 43 It is primarily spread between people via respiratory droplets from coughs and sneezes. 18 A study investigating the rate of decay of the virus found no viable viruses after 4H on copper, 24 hours on cardboard, 72H on stainless steel, and 72H on plastic. However, detection rates did not reach 100% and varied between surface type. Limit of detection was 3.33 times 100.5 TCID 50 per liter of air for aerosols, 100.5 TCID 50 per milliliter of medium for plastic, steel, and cardboard, and 101.5 TCID 50 per milliliter of medium for copper. Estimation of the rate of decay with a Bayesian regression model suggests that viruses may remain viable up to 18H on copper, 55H on cardboard, 90H on stainless steel, and over 100H on plastic. The virus remained viable in aerosols throughout the time of the experiment. 3H44. The virus has also been found in feces, and transmission through feces is being researched. 4512. The lungs are the organs most affected by COVID-19 because the virus accesses host cells via the enzyme ACE2, which is most abundant in the type II alveolar cells of the lungs. The virus uses a special surface glycoprotein called a spike peplomer to connect to ACE2 and enter the host cell. 46. The density of ACE2 in each tissue correlates with the severity of the disease in that tissue, and some have suggested that decreasing ACE2 activity might be protective. 47-48. Though another view is that increasing ACE2 using angiotensin II receptor blocker medications could be protective, and that these hypotheses need to be tested. 49. As the alveolar disease progresses, respiratory failure might develop and death may follow. 48. The virus also affects gastrointestinal organs as ACE2 is abundantly expressed in the glandular cells of gastric, duodenal and rectal epithelium. 12. As well as endothelial cells and enterocytes of the small intestine. 50. The virus has been found in the feces of as many as 53%. 12. Of hospitalized people, and more anal swab positives have been found than oral swab positives in the later stages of infection. 51. The virus was found in feces from 1 to 12 days, and 17% of patients continued to present the virus in feces after no longer presenting them in respiratory samples, indicating that the viral gastrointestinal infection and the potential fecal-oral transmission can last even after viral clearance in the respiratory tract. 12. Reoccurrence of the virus has also been detected through anal swabs, suggesting a shift from more oral positive during the early stages of the disease to more anal positive during later periods. 51. The virus is thought to be natural and have an animal origin. 52. 53. Through spillover infection. 54. The origin is unknown, but by December 2019 the spread of infection was almost entirely driven by human-to-human transmission. 55. 56. The earliest known infection occurred on the 17th of November 2019 in Wuhan, China. Preventive measures to reduce the chances of infection include staying at home, avoiding crowded places, washing hands with soap and warm water often and for at least 20 seconds, practicing good respiratory hygiene and avoiding touching the eyes, nose, or mouth with unwashed hands. 79, 80, 81. The CDC recommends covering the mouth and nose with a tissue when coughing or sneezing, or using inside of the elbow if no tissue is available. 79. They also recommend proper hand hygiene after any cough or sneeze. 79. Social distancing strategies aim to reduce contact of infected persons with large groups by closing schools and workplaces, restricting travel, and canceling mass gatherings. 82. Social distancing also includes that people stay at least 6 feet apart, about 1.80 meters. 83. Because a vaccine against SARS-CoV-2 is not expected to become available until 2021 at the earliest. 84. A key part of managing the COVID-19 pandemic is trying to decrease the epidemic peak, known as flattening the epidemic curve, through various measures seeking to reduce the rate of new infections. 75. Slowing the infection rate helps decrease the risk of health services being overwhelmed, allowing for better treatment of current cases, and delaying additional cases until therapeutics or a vaccine become available. 75. According to the WHO, the use of masks is recommended only if a person is coughing or sneezing or when one is taking care of someone with a suspected infection. 85. Some countries also recommend healthy individuals to wear face masks, particularly China. 86. Hong Kong. 87. And Thailand. 88. Some health experts consider wearing non-medical grade masks and other face coverings like scarves or bandanas a good way to prevent people from touching their mouths and noses, even if non-medical coverings gloves would not protect against a direct sneeze or cough from an infected person. 89. Those diagnosed with COVID-19 or who believe they may be infected are advised by the CDC to stay home except to get medical care. Call ahead before visiting a healthcare provider. Wear a face mask when exposed to an individual or location of a suspected infection. Cover coughs and sneezes with a tissue. Regularly wash hands with soap and water and avoid sharing personal household items. 91. The CDC also recommends that individuals wash hands often with soap and water for at least 20 seconds, especially after going to the toilet or when hands are visibly dirty, before eating and after blowing one's nose, coughing, or sneezing. It further recommends using an alcohol-based hand sanitizer with at least 60% alcohol, but only when soap and water are not readily available. 79. For areas where commercial hand sanitizers are not readily available, the WHO suggested 2 formulations for the local production. In both these formulations, the antimicrobial activity of ethanol or isopropanol is enhanced by a low concentration of hydrogen peroxide, while glycerol acts as a humectant. People are managed with supportive care, which may include fluid, oxygen support, and supporting other affected vital organs. 94, 95, 96. Steroids such as methylprednisolone are not recommended unless the disease is complicated by acute respiratory distress syndrome. 97, 98. The CDC recommends that those who suspect they carry the virus wear a simple face mask. 25. Extracorporeal membrane oxygenation (ECMO) has been used to address the issue of respiratory failure, but its benefits are still under consideration. 71, 99. While WHO does not oppose the use of non-steroidal anti-inflammatory drugs such as ibuprofen for symptoms, 100, some recommend paracetamol, acetaminophen, for first-line use. 101. While theoretical concerns have been raised about ACE inhibitors, as of the 19th of March 2020 these are not sufficient to justify stopping these medications. 102. The WHO and Chinese National Health Commission have published recommendations for taking care of people who are hospitalized with COVID-19. 103. 104. Intensivists and pulmonologists in the U.S. have compiled treatment recommendations from various agencies into a free resource, the IBCC. 105. 106. Personal protective equipment precautions must be taken to minimize the risk of virus transmission, especially in healthcare settings when performing procedures that can generate aerosols, such as intubation or hand ventilation. 107. Some public health officials have complained that the limited supply of protective gear should not be used to expand outpatient testing. New York City has departed from CDC guidelines and is recommending that testing be limited to hospitalized patients to conserve supplies. 108. CDC outlines the specific guidelines for the use of personal protective equipment during the pandemic. The recommended gear is as follows: gown, mask or respirator, 109, 110, goggles or a face shield, 111, medical gloves, 112, 113. The N95 respirators are approved for industrial settings, but the FDA has authorized the masks for use under an Emergency Use Authorization, EUA. They are designed to protect from airborne particles like dust, but effectiveness against a specific biological agent is not guaranteed for off-label uses. 114. When masks are not available, the CDC recommends using face shields, or as a last resort homemade masks. 115. Mechanical ventilation. Most cases of COVID-19 are not severe enough to require mechanical ventilation, artificial assistance to support breathing, but a percentage of cases do. 116. 117. Some Canadian doctors recommend the use of invasive mechanical ventilation because this technique limits the spread of aerosolized transmission vectors. 116. Severe cases are most common in older adults, those older than 60 years. 116. And especially those older than 80 years. Citation needed. Many developed countries do not have enough hospital beds per capita, which limits a health system's capacity to handle a sudden spike in the number of COVID-19 COVID-19 cases severe enough to require hospitalization. 118. This limited capacity is a significant driver of the need to flatten the curve to keep the speed at which new cases occur and thus the number of people sick at one point in time lower. 118. One study in China found 5% were admitted to intensive care units, 2.3% needed mechanical support of ventilation, and 1.4% died. 71. An Italian startup employed 3D printing technology to produce valves for life-saving coronavirus treatment due to a broken supply chain of original manufacturing. 119. 3D printed valves cost $1 instead of $11,000 and were ready overnight. 120. Experimental treatment. See also, research. No medications are approved to treat the disease by the WHO, although some are recommended by individual national medical authorities. 121. Research into potential treatments started in January 2020. 122. And several antiviral drugs are in clinical trials. 123. 124. Although new medications may take until 2021 to develop. 125. Several of the medications being tested are already approved for other uses, or are already in advanced testing. 121. Antiviral medication may be tried in people with severe disease. 94. The WHO recommended volunteers take part in trials of the effectiveness and safety of potential treatments. 126. Information technology. See also, algorithmic regulation. In February 2020, China launched a mobile app to deal with the disease outbreak. 127. Users are asked to enter their name and ID number. The app is able to detect close contact, using surveillance data and therefore a potential risk of infection. Every user can also check the status of 3 other users. If a potential risk is detected, the app not only recommends self-quarantine, it also alerts local health officials. 128. Big data analytics on cell phone data, facial recognition technology, mobile phone tracking and artificial intelligence are used to track infected people and people whom they contacted in South Korea, Taiwan and Singapore. 129. 130. In March 2020, the Israeli government enabled security agencies to track mobile phone data of people supposed to have coronavirus. The measure was taken to enforce quarantine and protect those who may come into contact with infected citizens. 131. Also in March 2020, Deutsche Telekom shared private cell phone data with the German federal government agency, Robert Koch Institute, in order to research and prevent the spread of the virus. 132. Russia deployed facial recognition technology to detect quarantine breakers. 133. Italian Regional Health Commissioner Giulio Galera said that he has been informed by mobile phone operators that 40% of people are continuing to move around anyway. 134. German government conducted a 48 hours weekend hackathon with more than 42,000 participants. 135. 136. Also the president of Estonia, Kersti Kaljulaid, made a global call for creative solutions against the spread of coronavirus. 137. Psychological support. Infected individuals may experience distress from quarantine, travel restrictions, side effects of treatment, or fear of the infection itself. To address these concerns, the National Health Commission of China published a national guideline for psychological crisis intervention on the 27th of January 2020.
Precautions for coronavirus. 1. Wash your hands, legs, and face with sanitizer or soap, as you came home from outside or from some place. 2. Avoid going to crowded and traffic-torn places. 3. Wear masks while roaming outside. 4. Eat homemade and well-cooked food. 5. Avoid contact with the person affected by coronavirus, and if then you should also keep yourself away from people. 6. Follow the laws of government and advices of doctors.